it is incredibly important and not a token gesture at all that we fully acknowledge that we stand on the land which is traditionally owned by the Gadigal people of the Eora Nation, and we must pay respect, proper respect, to elders past, elders present, and probably most important of all, future elders in development, if you like. And to welcome us to country is Uncle Alan Madden. Please welcome Uncle Alan.
Thank you. Once again, my name is Alan Madden, Gadigal Elder. Minister, distinguished guests, ladies and gentlemen, it's always a pleasure to come down to Tech Park here. I was born 100 yards away, that away, in Cornwallis Street, way back in 1990, I think it was. My father started back to work here after he came back from the war. My brother worked for the railways for 38 years as well. And my mum has always been involved in the railways. As a grandfather, great-grandfather, he started work on the railways on the Hawkesbury River when they started the rail line on the other side. First of all, I'd like to acknowledge our Aboriginal elders, all elders, past and present, and pay my respects to all our Aboriginal and Torres Strait Islander brothers and sisters, from whatever Aboriginal or island nation you may have come from. Welcome to Gadigal. And to all our non-Indigenous brothers and sisters here today, a very warm and sincere welcome to you to Gadigal. No matter where you've come from, whether it be across the seas, across the state or across town, once again, a very warm and sincere welcome to you to Gadigal. As I've mentioned many times before, was, is, and always will be Aboriginal land. Only three things shorter than that: coming, taxation, and going. It is an honour and a pleasure to be here today to welcome one and all to Gadigal. Gadigal is one of 29 clans of the Eora Nation. The Eora Nation is bounded by nature's own, the Hawkesbury River to the north, the Peene to the west, and Georges River to the south. And in between those three mighty rivers is the Eora Nation. And in that nation, there are 29 clans. And the clan's land we're on today is Gadigal. On behalf of members of the Metropolitan Local Aboriginal Land Council and of the Gadigal mob, welcome, welcome, welcome. Thank you.
Thank you, Alan. And now to officially welcome you to the conference on behalf of the Cancer Institute New South Wales is the Chief Executive Officer of the Cancer Institute, Professor David Currow, and who is also Chief Cancer Officer for New South Wales. Please welcome David.
Thanks very much, Norman, and I too would like to acknowledge the Gadigal people who are the traditional custodians of the land on which we meet today and pay my respects to their elders past and present. Minister, Norman Swan, colleagues, welcome to the 2016 Innovations Conference. What we have in this room is a fantastic brains trust that is doing great things to work out how we can deliver better cancer services across the state. At the end of the day, a healthy system is one that innovates and, most importantly, shares that innovation in a practical and day-to-day way to improve what we do. We have a state filled with committed clinicians delivering fantastic services. The really big advances that we can make in the next 5 to 10 years are related directly to our ability to get the system to work better for patients. And that's not about buildings, it's not about infrastructure, it's about how we work together. And what we see today, showcased in the presentations this morning, in the parallel sessions during the middle of the day and again this afternoon, is about how we can work together more effectively and more efficiently. The theme today is about psycho-oncology, and it's incredibly important that as we move into this new cancer plan, that we recognise that psycho-oncology is an integral part of good care, that it does improve outcomes, that good psycho-oncology is an investment in the health of our community. And as we make that investment, we need to make sure that we make it equitably right across the state. And working together with local health districts, primary health networks, Aboriginal medical services, and cancer service providers, the commitment is that we will make sure that this is more equitably delivered across New South Wales. We're delighted to have Professor Jane Turner with us today, and thank you, Jane, for being with us for the last couple of days and running a workshop yesterday. Our panel members, most of whom you will know already, our partners from the pillars, the Agency for Clinical Innovation, the Clinical Excellence Commission, the Bureau of Health Information, Health and Education Training Institute, directors of cancer services, cancer service innovation managers from across the state, our colleagues from primary health networks, great to have you here. We want to work more closely with you. We want primary care as part of the solution to better cancer outcomes. Aboriginal medical services, we continue to build relationships there. It's crucial that we do so, and there is no doubt that we can make a much bigger impact on improving cancer outcomes in Aboriginal communities by working closely together. Researchers, particularly from the Translational Cancer Research Centres and all of the centres that they have engaged in their process of accelerating, bringing new knowledge from the laboratory, from the computer, from our studies to the bedside. And most of all, colleagues. I'm also delighted to welcome several consumers today. Please enjoy the day. Please take the opportunity to collar people, ask them what's going on, understand how we're delivering better cancer outcomes in New South Wales because of the way we're structuring the system. Finally, this afternoon, we finish with self-care. Seems very appropriate for a Friday afternoon. We're not good at self-care. In cancer, we're particularly bad at self-care. But I'd like to suggest that it is an investment. That if we actually look after ourselves, the care we offer to the patients whom we serve will be better. We will engage with them better, we will serve them better, we will meet their needs more quickly and more effectively. So no matter how tempting it is, self-care is an integral part of being a good health professional, and we'll reflect on that in the last panel discussion this afternoon. So stick around. I'm not sure that we're supplying the most important bits of quality of life immediately after that, but there are several pubs within walking distance. Ladies and gentlemen, I hope you have a great day at this Innovations Conference. It's great to see that this is the biggest conference we've had yet. The numbers speak for themselves. The number of groups who want to showcase their work speaks to the quality of the innovations that are happening across the state. It's now my very great pleasure to ask the Minister for Health, the Honourable Gillian Skinner, to officially open today's conference. And it's a delight to have you here today, Minister. What you continue to do in supporting cancer is unprecedented, and it's making a difference. So thank you.
Thank you very much indeed. May I begin also by acknowledging the traditional custodians of the land upon which we meet and pay my respect to elders past and present. And I said to Uncle Alan before he had to leave, I'm very thrilled to see how that welcome to country has evolved over time. It really is a very heartfelt and very symbolic gesture to the real appreciation that we have to our Indigenous members of the community for the great custodianship they have of our land. To Professor David Currow, to Norman Swan, thank you very much for being again the MC, and to all the very distinguished visitors who are here. It really gives me a great deal of pleasure to open this, the 5th annual Innovations in Cancer Treatment and Care Conference. It is I have done every one since it started in 2012, and it's great to see how it continues to grow each year and provide tremendous opportunities for health professionals to come together to share their ideas, their innovations, and to make a really big difference to the outcomes for people affected by cancer. I'm really pleased to see that there are more than 400 people registered for today's event, and as David has said, from a whole range of organisations and disciplines. So we've got nurses, medical radiation therapy and allied health disciplines across the board, and I'm as well heartened to learn that the local health districts are well represented, as are the pillars, and that the conference will be streamed live via online webcast for those who can't attend today, and the video published on the Cancer Institute's website after the event. Believe me, I'm going to ask my parliamentary colleagues to take a look at it, because innovation and the new ways of dealing with treatments, but also the way healthcare and other services are provided in government seems to be a very popular thing to consider these days. I think health has been way ahead in terms of innovation, and I believe that cancer treatments are leading the way. So a diagnosis of cancer can be absolutely devastating for the patient and their loved ones, as you know, and living through the treatment of cancer can be just as traumatising. We want to do everything we can to assist people to be well through their cancer experience, which makes this year the focus of psychosocial care an incredibly important one. We know that in New South Wales, the treatment received by people with cancer is among the best in the world. However, the psychosocial impact of cancers is always going to be troubling and significant. So I particularly welcome Professor Jane Turner, who has been invited to be the keynote speaker today. Professor Turner and her team have significantly contributed to our understanding of psychosocial, emotional and social needs of people affected by cancer. And this really came home to me when I was at an event with Michelle Haber from the Children's Cancer Institute a couple of years ago, where families were talking about the psychological impact lifelong of their cancer treatment. And the more we understand, the more we can be innovative about how we address that, the better it will be. So today provides us all with the opportunity to reflect on the value of good psychosocial care and to be aware of the critical role that everyone working in cancer care has in the psychological, emotional and social health of people affected by cancer. By coming together today to share learnings and progress in this area, we can further enhance outcomes and reinforce our holistic patient focus. So I'd like to highlight the New South Wales Cancer Plan, which was launched in April this year, a truly statewide plan, and many of us here today have been involved in its development. It's our roadmap to ensure people, including carers and families affected by cancer, can access appropriate services and continue to receive world-class care here in New South Wales. So I believe that we've been very fortunate to see how the health system here has evolved with particularly dedicated professionals and able now to respond to such challenges. I'm confident that those posed by psycho-oncology will be no different. Events such as today's conference can only strengthen our capacity to move forward with this important area of work. I hope that everyone today enjoys learning from each other, and I congratulate everybody involved in it. I am very pleased to formally declare the 2016 Innovations in Cancer Treatment and Care Conference officially open. Thank you.